Well, thanks to Carl and the Campaign for Public Health for inviting me to come and speak to this group today. First, let me ask, how many people here have already gotten their flu shots? I'm preaching to the choir. Okay, good. The National Foundation for Infectious Diseases is a 501c3 nonprofit. We were founded in 1973, and we are dedicated to educating the public and healthcare professionals about the causes, treatment, and most important, the prevention of infectious diseases. The CDC has declared vaccines as one of the greatest achievements of biomedical science and public health. But many consumers and healthcare professionals don't recognize the value of vaccines, partly because they've done such a great job of protecting us. Before vaccines were available, infectious diseases exacted an enormous toll on our population. And behind me are some sobering annual statistics from about 100 years ago, when our population was just 1/4 to 1/3 of what it is now, and our population density was much lower. Now, with a US population of over 300 million, smallpox has been eradicated, and these other killer diseases have largely disappeared in the United States. We've seen elimination or enormous reductions in many other diseases that were once common, including polio, Hib disease, and rubella. The primary reason for this downward trend in disease burden is clear: our very successful childhood immunization program. One of the major challenges facing adult immunization is that we've done such a good job vaccinating kids that as adults we think we're protected for life by the vaccines we got when we were younger. But adolescents and adults need booster doses for some childhood vaccines, and several newer vaccines specifically targeted to adults have emerged. They provide us with an important opportunity to stay healthy, but they are not being used as recommended. Lagging vaccination rates result in the vast majority of Americans dying from vaccine-preventable diseases every year being adults. The burden is more than just deaths. Hundreds of thousands of US adults are hospitalized annually, and millions get sick using healthcare dollars, missing work, and being unable to meet their daily obligations, both in the workplace and at home. The price tag for low immunization rates is high. It includes pain, disability, dollars, and death. Until about 12 years ago, influenza vaccine was recommended only for people 65 years of age and older, and a few groups with underlying medical conditions. But with the gradual expansion of those recommendations, we now have a universal recommendation. Everyone in the United States, 6 months and older, should be immunized every year against influenza. Pneumococcal vaccine recommendations have been expanded over the last few years to include all smokers and those Americans with asthma. And while a tetanus vaccine booster has long been recommended, it is now given along with a booster for adults to protect against pertussis. Adults 60 years and older are recommended to get zoster vaccine to protect against shingles. And HPV vaccine is recommended for young female adults under the age of 26. Earlier this week, some of you may know, there was some news from the ACIP meeting in Atlanta. And it's now been recommended that males ages 11 up to 21 receive the 3-dose course of HPV vaccine. And in addition, the other new recommendation coming out of the meeting this week was that hepatitis B vaccine has now been recommended for education and awareness are keys to getting consumers and medical professionals to be more proactive about vaccination. There's been a small but steady increase in adult vaccination rates in recent years. The parallel surveys showing increase in consumer vaccine awareness. But still, most adult vaccination rates are substantially lower than what we see in children or even adolescents. Awareness is key because unlike pediatric recommendations, we have no vaccine for children equivalent for adults. We have no mandates for adult immunization. And routine immunization and routine process does not exist. On the positive side, surveys that NFID has conducted show that adults are largely vaccine positive, and they will get vaccinated if their healthcare professional recommends it, and they will respond positively if the vaccine is readily available and convenient. NFID's adult vaccination call to action states that adult immunization must become a fundamental part of routine patient care. We believe this is essential for our public health. We know that significant changes in immunization rates require the commitment of all healthcare providers, not just physicians, but nurses, nurse practitioners, physician assistants, pharmacists, and other professionals who have meaningful contact with adult patients. 31 stakeholder organizations have joined NFID by signing on as supporters of the goals listed in the call to action. In broad strokes, we know what the barriers are to adult immunization. Lack of awareness among consumers and lack of resources and knowledge, both among healthcare providers and the public. When asked in surveys, most healthcare providers say they support adult immunization, but they often neglect to make it an active part of patient care because of the challenges of stocking vaccine and because they're busy in the acute care model of health that dominates this country. The amount of time in raising the topic, addressing the benefits, and encouraging patients to be immunized is also a challenge. However, when patients ask for vaccine, it appears they usually are greeted with a resounding yes from their doctor. Unfortunately, most patients do not feel comfortable engaging their doctors in this kind of conversation. They wait for the doctor to raise the issue. NFID's Adult Immunization Initiative is a priority for the organization, and in 2012 we will be kicking off several new programs. One is adult vaccination. It's for all of us, and that really has two meanings. First, no matter who you are, no matter how old you are, as a US adult, there are vaccines you need and that are recommended for all of us. But also, when you get immunized, you are doing it for all of us. The benefit is to you, but it also extends to those around you. The programs that we'll be kicking off will be a multifaceted approach to advance both public and professional dialogue about vaccines for adults. I encourage you to visit NFID's adult vaccination website. There's a lot of useful information there and a lot of material you can download and pass along to your constituents. There's a lot to be done, and we all plan to commit, we need to plan to commit time and resources to make adult immunization the norm in this country. We know of some of the essential elements to a successful immunization program. We need immunization registries. We need appropriate reimbursement policies for Medicare and Medicaid and private insurers. And we need Section 317 funds to be expanded to accommodate adult vaccines. And finally, Specialists as well as primary care physicians need to be educated on the value of immunization, and this should begin in medical school and continue throughout their careers. Thank you.